name's Abdul. I will be your provider today. Can you tell me your name and date of birth, please?
I'm Miss A. Birthday is September 1st, 1985.
Nice to meet you, Miss A. Can you tell me what brought you in today?
Yeah, I've been coughing a lot for the past 10 days, and I also have had a fever.
Okay. And so let's just dive into both. So for the coughing, can you tell me if it was a productive cough or a non-productive cough? Productive being you've been coughing something up. Non-productive being it's been kind of like a dry cough.
Yeah, I cough up a lot of phlegm. It's been green, but then for the past 2 days, it's been red.
Red. Okay. Have you taken anything just related to the cough, like any cough medicine?
No.
Okay. So for the fever, how high did the fever get?
About 100.3?
100.3. Okay. Any chills or anything like that?
No.
No? Okay. Any body aches?
No.
No? Do you take anything for the fever?
No.
You didn't take like Tylenol, Advil?
No, I just took Tylenol for the headache that I've been having. That's
Gotcha.
been about 5 days.
Gotcha.
Mm-hmm.
Okay. And then for the headache, is it just the headache, or are you having like any like neck pain, any pain behind pain behind your eyes, any sinus or any sinus congestion, anything like that?
Just some ear pain on the right side.
Okay. Any discharge coming out of the ear?
Nope.
No. Any sore throat?
No.
No. Okay. And just to double check, no facial pain, like no pain, like behind your nose or right here.
No.
Okay.
No. I do feel the most discomfort at night when I'm sleeping because I'm just coughing so much that I can't sleep, but
Got
no discomfort.
Okay. Does anything make the cough better? Is it drinking more water? Is it sitting up straight, or does anything kind of give you relief? No.
No.
Does anything relieve the pain of your right ear?
No.
Does anything make it worse?
No.
No? Okay. Does anything make the headache worse?
No.
No? Nothing you can think of? Okay. And then as far as travels, have you been out of the country anywhere kind of where you could have picked up any, sickness or illness?
No time. I've just been working.
Just been working. Are you around any coworkers that are sick? Any kids that are sick?
Yeah, I'm a teacher, but a lot of my coworkers have been sick.
Okay. Are you up to date with like your vaccines, like your COVID-19, your flu vaccine, also your tetanus shot, anything like that? Okay. Do you take any other medications? Like, do you take any allergy meds? Do you take any blood pressure meds?
Allergy meds, just when needed.
Okay. Is it like a Zyrtec, Allegra?
Zyrtec.
Zyrtec, okay. Just the regular standard dose?
Yes.
Okay. For family history, any history of heart attack, stroke, anything like that?
Nope.
No? Okay. Both sides, mother and father?
Yep.
Okay. For your history, are you pretty active? You go to the gym, you do your walking, stuff like that?
I don't go to the gym, I walk, but like I said, shortness of breath, I haven't really been able to.
It's kind of tough.
Yeah.
Okay. Do you partake in any illicit drugs, like any recreational drugs or smoking, anything like that? Drinking?
I smoke about a pack of cigarettes every day.
Pack of cigarettes. Okay. When was the last pack, if you don't mind me asking?
Yesterday.
Yesterday. Okay. Okay, yesterday. Okay. And then for your last bowel movement, when was that?
Yesterday.
And you're peeing okay?
Mhm.
No burning sensation, nothing like that? Okay. Any nausea, vomiting, diarrhea?
Nope.
Okay. All right. So with that all kind of taken care of, I kind of want to go through like a head to toe real fast. I'll touch on the ear and I'll touch on other areas that as things come up, just let me know. But it'll just be a full head to toe and we'll kind of see where things land, okay?
Okay.
I'm going to quickly wash my hands and put on some gloves and then we'll get started, okay?
Mhm.
And then I'm going to ask you, is it okay to touch you?
Mhm.
Okay. So I'm going to come to my patient, I'm going to come to you and I'm going to grab the back of the skull, make sure that there's no decrepitous bones or anything sticking out that's causing any pain or discomfort. I'm going to move down the back of her spine slowly. Any pain or discomfort?
No.
No? Okay. Now I'm going to gently palpate the top of her skull. Any pain or discomfort?
No.
No? Okay. And you told me that you did not have any sinus congestion, sinus pain, sinus pressure. Have you ever had any sinus surgery or any surgery to the oral cavity?
Yeah, I have had surgery when I was a kid. It had to do with something over here. I'm not remembering.
It was your tonsils, correct?
Yeah.
Okay, so you had a tonsillectomy.
Yeah.
Usually with that, they take out your tonsils and they take out your adenoids. So
Got it.
usually it helps decrease any signs or any chances of bacteria growing inside the mouth because it's like a great way for it to harbor bacteria. But so you got yours removed when you were a kid.
Yes.
Okay. So I'm going to gently go ahead and press on these pressure areas and let me know if you have any pain or discomfort, okay?
Okay.
Any pain or discomfort?
No.
I am touching on her sinus cavity and there is no pain or discomfort. So while I'm here, I'm going to go ahead and examine your ears, okay? Just to make sure that there's nothing going on in your ear canal. I'm going to be taking my pen light. I'm moving her hair out the way. Now I'm taking my pen light and I'm going to be moving up and back, okay? So I'm going to move up and back, looking inside her ear canal. It's unremarkable. Coming on her right hand side. I'm going to pull up and back, taking a look inside her ear canal. There is some swelling inside, some are inside the ear canal, as well as some redness as well. And you told me that there was no discharge, correct?
Correct.
Okay. So now I'm going to take my pen light. I'm going to ask you to follow it for me. So just follow it from right to left. Okay. And then I'm going to be using this pen light to also look at your pupils, okay? So look straight ahead and I'm just going to shine the light, okay? Pupils are reactive to light. They're 3 millimeters, which is normal and unremarkable for both sides. Now I'm going to be looking inside her nasal cavity. So I'm going to take the light, ask you to look up, looking inside her nasal cavities. So they are both unremarkable. She is noted with a septum piercing, but no deviation that I'm able to observe on her nasal cavity. So then asking her to just briefly open her mouth so I can take a look at her oral cavity to make sure that it lines up with the tonsillectomy and the adenoidectomy with the absence of those in her oral cavity. So now I'm looking inside, say, very good. Everything is unremarkable, tongue is intact. There's no redness, no swelling to her oral cavity. Teeth are also intact as well. So just briefly, I'm going to just pause this real fast. I'm going to be taking your vital signs just really fast just to make sure that everything is, unremarkable. I'm going to do your blood pressure. I'm going to apply the blood pressure to your arm. I'm going to be taking your temperature, and I'm going to be putting this pulse oximeter on your finger, and that's going to tell me how well you're breathing, okay? Before I get into the examining how your lungs sound.
Okay.
So vital signs are all stable, and they're unremarkable, and they're present. So now I'm going to go ahead and take my tuning fork, and then I'm going to try to assess her auditory sensory. Now I'm going to be tapping this fork on the chair and asking you to let me know when you no longer hear the sound.
Okay.
Okay, and I'm tapping the fork on the chair, putting it to the patient's ear, and she's letting me know when she does not hear the sound anymore. And depending on her answer, it will fall in line with the pain and the swelling to her ear canal that is congruent with, let's say, her right side having a little bit of a deficit. So now I'm going to be listening to her lung sounds, and then while I'm listening to her lung sounds, I'm going to go ahead and auscultate her heart to listen to her heart sounds as well. So I'm going to put on my stethoscope. I'm going to ask the patient to sit up. I'm going to listen to her heart sounds. S1 and S2 are noted. Now I'm going to listen to her lung sounds. Take a deep breath for me. Take a deep breath for me. Take a deep breath for me. And then take a deep breath for me. Very good. So now I'm going to move her hair out the way so I can place the stethoscope on her back. Take a deep breath. Deep breath. Listening to her lung sounds. Deep breath. Deep breath. Very good. I did note a little bit of diminished lung sounds on the left lower lobe and right lower lobe, but that kind of falls in line with some of the shortness of breath that you're having as well. So now moving down, how have you been feeling in terms of your musculature? Do you feel like you've lost any muscle, you've been able to retain muscle, or you feel like you've had some atrophy?
It's been the same.
Okay, been the same. And as far as cardiovascular, have you had any chest pain, any chest tightness, anything like that?
Just a shortness of breath.
Just a shortness of breath. Okay, but no chest pain. No.
No.
Okay, very good. So now moving down, I'm going to percuss on her abdomen as well as her chest cavity, just briefly. So now I'm percussing. Now I'm going to percuss on her anterior side. Very good. So now I'm going to ask you to sit up straight, and then I'm just going to palpate your abdomen. I'm palpating her abdomen on all 4 quadrants. Any pain or discomfort?
Nope.
Okay. And have you had any nausea, vomiting, or diarrhea?
Nope.
And then at this point, bowel sounds are present. I'm going to percuss her abdomen as well. Okay, very good. And then have you had any pain or discomfort on your bladder area, which is kind of underneath your belly button?
Nope.
No? Okay. Do you mind if I check on your hands? Hands are grossly intact. There's no wounds or open skin. Her calf refills are present. They are less than 3 seconds. Calf refills are also less than 3 seconds. Again, skin is grossly intact. And I'm going to ask you to squeeze both my fingers for me. Squeeze, very good. As far as your lower extremities, have you noticed any weakness over the past few days? Any falls recently?
Nope.
No, very
No
good.
pain.
I'm going to go ahead and take a look at your lower extremities. No pain in your right knee, no pain in your left knee?
No.
Okay, very good. I would test the reflexes on both knees. I would test, and then I would test. We would get a reflex, and then I would go ahead and move down to her lower extremity. I'd be checking for her on her calf if she was experiencing any tenderness, any warmth, swelling, redness. That is unilateral, so it's happening on one side and not the other. So right now you have no pain, no tenderness, no warmth, nothing like that. Very good. She has no edema on her bilateral extremities. No husky dust or no husky tone to it, like a purplish pink redness. That can indicate kind of blood pooling. That can indicate a DVT. Her pedal pulses are being assessed, and they are present. Her pedal pulses are being assessed, and they are present. Calf refills are also present. Now moving on to her left lower extremity, I'd be looking for the exact same. Any warmness, any tenderness, any redness to her calf, which is absent. There is no edema present on her left lower extremity. As far as her pedal pulses, I'm going to be examining her pedal pulses. Her pedal pulses are present. And checking for her calf refill, those are also present as well. I'm going to ask you to lift up against my hands for me, please. Very good. And then I'm going to ask you to press down on the gas pedal. Very good. She has good gross motor skills as well on her bilateral lower extremities. Okay, so as far as the head to toe assessment, everything seems to kind of fall in line with what we've been talking about. You're having the right ear pain. I did notice some of the swelling in your ear canal. That could be causing some of that pain as well. Do you have any allergies that you can think of? Any allergies to medication that I should ask?
No allergies to medication. I just have allergies that I take medication for.
Gotcha. And I believe we discussed that it was just the Allegra and the standard dose. Okay, very good. Have you had antibiotics before in the past?
I have, but I'm not allergic.
Okay. So my recommendations for you would be, we're going to order a chest x-ray. That's going to see what's going on with your lungs and kind of if there's any fluid buildup in or around your lungs. And then also I'm going to encourage you to increase your fluid intake. because by increasing your fluid intake, that will increase the chances of the secretions, the mucus, being able to thin and kind of disperse on their own, and or you're able to cough it up. Even if you were to take a expectorant, which is a form of like Mucinex, that'll help thin up the secretions as well and kind of help you again get rid of all the mucus. I would like for you to also stop smoking, because that's gonna exacerbate your chances of having shortness of breath. Yeah, that's gonna make it worse. So try to stop smoking in the meantime, preferably altogether, but especially in the meantime. For follow-up, I want to be able to get you back in 24 to 48 hours, sooner if anything gets worse. So if anything gets worse, be sure to just go to the emergency room, get checked out. If you're having difficulty breathing, if you're having chest pain, if you're experiencing fluid that is clear coming through or coming down your nostrils or down your ears, that is a cerebral spinal fluid leak, so you want to get that addressed. The chances of it being something similar to bronchitis or an ear infection it's pretty considerable, but again, it's very treatable with antibiotics. So as long as we take care of that, that'll be great. Do you have any questions for me?
Nope, thank you.
No, of course. Yeah, so be sure to make sure you get checked out 24 to 48 hours, and yeah, I'll see you back here soon.
Thank you.